This is AP Med. My name is Andrew Poveda, and I am interviewing Dr. Del Carmen. He is a resident in cardiothoracic surgery. For medical school, he went to the Perelman School of Medicine, and right now he's a PGY1 for cardiothoracic surgery. Do you want to give me a little bit of details about yourself? Do you want to introduce yourself?
Sure, yeah. I'm Henry Del Carmen, and please feel free to call me Henry. No need to call me Dr. Del Carmen or anything like that.
Okay, got it.
I was born and raised in Managua, Nicaragua, and had a great time growing up in my country. Gave me a lot of perspective. Decided to pursue medicine in the United States. So I went to college in Emory University in Atlanta. I studied business there. A pre-medical student, and I did this because I felt that business could give me the key skills to be a change maker in whatever I go into. So I knew that I wanted to have a big impact in healthcare, like beyond my patients. So having a business background gives you tools to affect beyond the patient. That was my take on it. I don't know if it was the right choice. I think it was. I love it. But then I went to the Perelman School of Medicine at the University of Pennsylvania for medical school. I was there for 4 years. That's where I found a love for the heart and for surgery, so natural intersection heart surgery. And then I matched into Montefiore Einstein's program for cardiothoracic surgery. So now I'm a first year here at Montefiore Einstein in cardiothoracic surgery. Other things about myself. I have hobbies outside of medicine and academia. I love music. I'm a guitar player. I play drums. I used to make music back in the day, not anymore. What else? In terms of sports, I love running. I love boxing. And I wish I were better at soccer, but it is fun.
Oh, man, yeah. I feel like every Hispanic bonds over soccer. Like, it's that one pickup thing where you could just pick up and play. Yeah, it kind of sucks. Yeah.
It's like, it's a sport that I was never good at,
mm-hmm.
and I don't really seek out to play it that much, but the few times that I get to play with friends, it's always a good time.
Yeah, of course.
I honestly, I have to be better with the gym, because, all of my fitness tends to be, goal-oriented. I used to do track in high school. So all of my fitness was oriented to being faster. And then when I was boxing more, all of my gym time was focused on how can I be a better boxer, let me optimize this. But now I haven't been boxing as much, so I have trouble getting into the gym and finding that motivation. But I'm getting into the groove of residency now and finding more time for my sports hobbies.
Good to hear. Yeah. How do you find time to do things that you enjoy, like you said, your hobbies? Because it's really, I find, and I'm sure a lot of other people find time management skills really hard. How do you balance it out? How do you set aside, I know a lot of people use planners, calendars. What's some advice you could give?
I'm a type B, type A person, or vice versa. I don't really use a calendar to plan out my free time or my hobbies or anything. I just take the day as it goes. I don't really have a strategy to find time to do my hobbies. It really depends on the rotation that I'm at and how much time I have free at the end of the day. If for XY reason I leave the hospital at 5 and I find myself having 4 or 5 hours of time where I can just take care of myself, I'll make sure to hit the points on the hobbies that I enjoy. I'm very intentional about playing guitar at least 5 minutes per day. And it sounds like very little, but just taking a little bit of time to do a little bit of something that you love, that can really be a game changer. So yeah, I don't really have a good answer for you. I just take the day as it goes, and even if it means 5 minutes of doing something that I love, I'll do it.
Got it. Yeah, I relate to you more than what would be a type B person? How someone that's plans everything out. I'm not so much of a planner myself. I'm pretty spontaneous. Like after this meeting, I'm gonna go to the gym, and I didn't really plan that. I just decided in the moment just to do it. But
I feel that, yeah.
Yeah,
it's
yeah.
I'm wondering right now, like what should I make myself for dinner? Like I don't plan everything out as much.
Yeah.
Like being in surgery does require you to be like type A to a certain extent, but I'm also very like sporadic in the way that I do things.
Okay. So, what does a day in the life look like for you as a first year resident?
That really depends on the rotation because in your first year especially, you're rotating through several different specialties, right? So if I'm on a general surgery rotation, I will usually be coming into the hospital at around 5:20. I get signed out at 5:30. What sign out means is the person who was on overnight tells you about the patients that you're going to take care of during the day. So that transition of care happens at 5:30. Then after that, I review all of the patient's charts. Then I round with the team, and what that implies is going as a team to every patient, discussing what happened the day before and what the plan is going to be for the day. Once I do that, I write all of my notes, put in all of the orders for the patients, right? So if any medications have to be changed, if anything has to be added, if you have to take any meds out or anything like that. And then after that, I go to the operating room or I go to clinic. So balancing being in the operating room for the entire day or clinic in the entire day while also taking care of the patients on the floor and in the ICU is pretty challenging, but definitely something that I enjoy. I feel like to be in surgery, you kind of have to thrive a little bit under pressure. If I'm in a non-surgical rotation, for example, if I'm in the ICU or if I'm on the floor as I am right now, I'm usually coming into the hospital like at 6:30, getting sign out as well. And then throughout the day, it's just continued care of the patients. Like you don't really have to juggle OR and clinic with your patient responsibilities. I'm usually leaving the hospital in non-operative rotations around 6:30. I go home. Hopefully I meal prep something. If I didn't, I'll cook. I love cooking. And after I cook, like so many times, I just sit on the couch, get my guitar, play for a little bit while I watch TV, and then I go to sleep. If I'm on a surgical rotation, my nights, they can go a lot longer. You might be leaving the hospital at 6:30, or maybe your last case is going over by a lot and you're leaving at 9, 10, 1 in the morning, who knows? And you have to show up the next day. So especially in surgical rotations, it does require a lot of adaptability.
So you mentioned that you love cooking and you're Nicaraguan, you said, right?
I'm Nicaraguan, yes sir.
What's your favorite Nicaraguan dish to make from your culture?
It would be cerdo con achote, gallo pinto, and maduro. So it's essentially like a pork loin or pork chop, cut it into cubes. You marinate it in either like lemon juice or like grapefruit juice or like any sort of like sour juice, and achote, which I don't know if there's a word for it in English, but it's a seed that is ground to a red paste. So you marinate it in that, and you let the pork kind of get like a nice red color. Then you cook your rice and beans, which we call gallo pinto in Nicaragua, separately. And you also fry some plantains. Then you cook the pork in a pan, and that's essentially it. That's one of my favorite places to cook. Like whenever I have the time to like make it properly, I love making it.
Yeah, I like cooking. I especially like baking myself. I think it's really important to have hobbies that you could just focus on and be like, I want to do this today. I want to do something else today. And you're not just focused solely on work or school or whatever you're stuck on, right? So, yeah, I like to hear that you have other hobbies outside of medicine. It's really intriguing to hear that some people aren't so one-dimensional, you know. So, oh yeah, more touching on your Latino roots. So I saw that you were part of LMSA. You were the president
Yes.
for your chapter.
Mm-hmm.
Do you want to touch upon that a little bit?
Completely. No, that was a great time. So so when I started medical school, one of the most important things for me was to find a good Latino community. And as soon as I got to medical school, the Latinos from the year above me kind of took me under their wing, and they were the leaders of LMSA at that time. So they kind of motivated and pushed me to become a leader in the Latino space at Penn. So then the following year, I applied to be president of the group. In reality, to be co-president of the group. So I had another co-president with me. And yeah, I was elected co-president, and we had a great time. My favorite part about it was essentially getting the new first-year medical students and bringing them onto the group, just like the second years did to me when I came to medical school. And in my opinion, it's important to bring Latinos together, because it's just something that we all share in common. Like, it's something about the Latino heritage that just really brings us together. Mm-hmm. And being in Latino leadership in medical school really allows you to reinforce, like, fostering that community. So now that I graduated, I see the people that were in the class below me kind of mentoring the ones that are below, and then those mentor the ones that are below them. So it's like a self-perpetuating cycle. It's really nice.
Yeah, it sounds like you're really passionate about it. I always like to hear people, especially people that are already kind of on the way to becoming physicians. Mm-hmm. They mentor students, pre-meds or medical school students, that they give that out for free. A lot of people, they charge, mm-hmm. or they expect something in return, but when you give something and don't expect anything back, that's when you truly give out what's most needed. I say my
completely, yeah.
Yeah.
And in the end, like the friends that I've made, like through LMSA, like they're my closest medical school friends. Like, most of them are fourth years and third years now, and even though I'm in New York, like, anytime I head down to Philly, like, I'm always hanging out with them. I'm having a good time with them. They're, like, always texting me. Like, we have a good time. There's, like, a really nice mentorship relationship, but above all, just great friendships that will last a lifetime. So that has been probably one of the most rewarding parts of being part of LMSA and medical school.
Yeah, I think it's really important to find your group wherever you go. So you said you're from Nicaragua, and then where did you move to exactly after?
After, I mean, my whole family is still in Nicaragua, but I went to college in Atlanta.
Okay. Yeah. So
and to Philly, and now I'm in New York.
Okay. Yeah, because I've seen that you've moved a lot throughout these past who knows how many years. How have you really adjusted to how many years has it been?
I think it's 9 years.
9 years.
I think.
I was gonna say 10. But
I don't know. Wait, I'm not doing my math correctly.
I think 9.
In 2017, we're in 2025. 9 years or something like that.
Okay. Yeah. Well, you moved from across the country to a whole nother country, then from Philly to New York. So how have you really adjusted to meeting new communities and finding the right people for you? Like, I know you said in medical school you immediately found LMSA, but how was it during undergrad, especially when you first moved to the U.S.?
It wasn't a challenge for me, but it's because I kind of cheated. When I went to college, like I immediately found a group of like very like tight-knit Latinos, mm-hmm. and we were a group of like maybe 20-something students that we would always hang out together. We would always go to the same parties together, do kind of everything together. So I still felt socially at home, since the people that I would socialize the most were Latinos that were like very similar to the people that I hung out with when I was back in Nicaragua. So that transition in college didn't really feel that hard. In my first in the first couple of months, like, it did feel a little bit lonely, like, without my family, but just having that support group of Latinos I shared a similar background with. That had just made the difference. And then in medical school, I was with my now fiance. So we hung out all the time. She's Puerto Rican, so I never really had to undergo much of I didn't have to adapt that much, to be honest. Now in New York, feels a little bit different than in Philly and Atlanta. So it has been more of an adjusting to a new transportation system, kind of being more of a real grown-up, Mm-hmm. Like now that I'm like out of school now and something that is more of a job, So that has definitely been more adapting. But yeah, in conclusion, I cheated by always hanging out with Latinos. So they always made me feel like I was at home.
Okay. Yeah. I think it's important to surround yourself with people that you really connect with. You don't want to just surround yourself with people that, like, you don't want to surround yourself with just a bunch of smart people just because they're smart. You want to really get along with people too. It's important to be personable, sure, but you want to do what's right for your mental health and really enjoy your experiences too. How was it applying to medical school, and how was it during your undergrad years? How did you prepare for that, the application cycle?
Great question. It wasn't easy. And looking back, I was definitely underprepared when I applied to medical. So there's like many different facets of your application to a medical school, right? Like you need the academic component and having good grades. That's unfortunately a given that you need to have. Then there's like the whole extracurricular component to it, which is like a lot more varied, and you kind of have to make your own path in that. And then here's the MCAT, which unfortunately is a very difficult exam that is extremely important to be able to get into medical school. So I feel that out of those three variables, MCAT and academics, they're kind of non-negotiables. The extracurriculars is where you get a lot more flexibility in defining who you are to medical schools. And aunt of mine, who I would say is my biggest mentor, she told me that when doing my extracurriculars and developing my application to medical school, I had to think of a mission that I had in medicine, that would weave all of my extracurricular activities together. So the mission that I was presenting to, the mission I wanted to bring to medicine was that I'm very interested in healthcare leadership and innovation, entrepreneurship. So everything that I did in my extracurriculars kind of resembled that area. So I did consulting for nonprofits in college, which shows the entrepreneurial, managerial side of solving problems. I did kidney disease screening programs in which I had to help coordinate and deliver preventive care services to underserved communities in Atlanta. I studied business, right? To reinforce that idea that I'm focusing on treating communities, not only patients. So that's kind of how I went about developing, let's call it my thesis for my medical school application. And in the end, it worked out. It really worked out. And what's interesting is that the medical school that I went to was the one that had values closest to what I was portraying in my application. So I feel that that's really important for pre-medical students to kind of find a mission that you have in medicine, because anyone who's pre-med and truly wants to be a doctor, of course, yes, you want to help people, you want to care for patients through the medical sciences and all that. But sometimes for medical schools, for admissions, that's not enough, and they want to hear what's your bigger mission in medicine. Yeah. So if you find that bigger mission and you find a way to weave all of your extracurriculars with that mission and kind of create a whole story and purpose with that, that's what's going to make you really effective into getting into medical school beyond your grades and your MCAT.
So what specifically drew you to medicine? Because you said you started out as a business major, but what made you make kind of the switch and decide that, I want to apply to medical school. I definitely want to do this, you know?
I mean, I never really had a switch. I always knew that I wanted to be a doctor. Like one of my uncles, he was my pediatrician. And ever since I was little, I remember going into his office, and he would be like so caring of me. He would teach me things like when I was very little. He would like hand me diagrams that he had. Of course, I didn't even understand what I was looking at, but it just seemed interesting, and he was always like a role model for me. So from early on, I instilled this idea that I wanted to be like him, that I wanted to be a doctor. Then when I was 15, I shadowed surgery for the first time. Shadowed a general surgeon in Nicaragua. And I had no idea what I was seeing. The first surgery that I saw was a radical prostatectomy. I didn't know what was radical about it. I had no idea what a prostate was. But seeing what was going on in surgery kind of just hooked me. And that was a moment where, with a slightly more mature mindset, I said, like, okay, I think I want to be a doctor. So I applied to college and everything, like with being like a doctor in mind, right? Studied business knowing that I wanted to pursue medicine. I'll confess, during the first half of college, I was tempted of maybe not pursuing medicine. I had kind of lost touch with the patient interaction component of it. But after interacting with patients through the kidney disease screening programs that I was part of, shout out to Hakati SAP, which is a tremendous organization that had helped me a lot when I was pre-med. Interacting with patients in their kidney disease screening programs, that had just like reignited that had passion for patient care and taking care of patients. So that kind of did like the final nail, you know, that I have to be a doctor.
You were sure of it at that point?
I was sure of it at that point, 100%. Now we're here.
Long journey. Still a lot of years to go. Yeah.
Oh yeah. At least 6 more.
I'm sure you've been asked this, maybe during interviews, but what specifically drew you to cardiothoracic surgery? Because you said you were interested in surgery because you've shadowed a couple surgeons before, but was there an experience during medical school, like during rotations, where you just saw a cardiothoracic surgeon and you were like, wow, I really want to do this, specifically this and nothing else in surgery? But what drew you to cardiothoracic surgery?
Yeah, it happened in a stepwise fashion. So I had this immature interest in surgery already, but I came into medical school with a really open mind. Like, I gotta explore everything, and I gotta see what I like. So stepwise fashion. Step 1, in anatomy, when we dissected the heart and the aorta, that to me was the coolest anatomy that I had ever seen. It was just insane. I was like shocked at how incredible it was. So that was like the first spark, you know, that interested me in the heart and the aorta. Then we had our cardiology course during medical school, and understanding cardiac physiology, pathophysiology, all of the disease processes that had to do with coronary artery disease, valvular disease, aortic disease. That seemed so interesting to me. At the same time, I was starting to shadow surgeons after taking anatomy. And now that I understood anatomy, I could prepare for cases, understand the anatomy, and understand the steps of what we were doing in surgery at a high level, right? I wasn't going to have like the deepest understanding of every decision in the OR, but I could follow through what we were doing. And seeing how surgery was like applied anatomy with clinical decision making, with technical skill, that was like incredible for me. So on one end, I was falling in love with the heart, And then on the other side, I was figuring out that I had to be a surgeon because it is so cool. So I love the heart. I love surgery. Natural intersection of that is heart surgery. So I eventually shadowed a heart surgeon in medical school. First surgery I saw was a cabbage. And seeing a beating heart in front of you, seeing it get stopped, worked on, and then restarted, that's just one of the most incredible things that I had ever seen. And seeing the level of technical complexity, like attention to detail, preciseness, man, it was honestly the best. Like after that, it was no turning back. I did a rotation as a clerkship student where I got to see even more variety of surgeries, got to see a lot of aortic surgery, some incredible surgeons. And then as a sub-intern, which is essentially when you rotate through a specialty as a fourth-year medical student and kind of see like how the life of a resident is. It's kind of an audition rotation. Like when I did that rotation and underwent the hours that it entails to be a heart surgery resident, I was still like even more in love with the specialty. There were some long days and long nights. Like you would go beyond 24 hours easy, wow. even more. But I could not see myself doing anything else. Like the impact that you can have on patients with heart surgery is just tremendous. So for me, after going through the trial of fire, that is, a sub-internship in cardiac surgery and seeing how tough the hours can really get, like if I went through that and I still love it, then I really love it. So that was like the final moment where I said, yeah, this is what I gotta do. Because you need to have like some sort of maturity you need a lot of maturity to be able to commit yourself to heart surgery. It's not an easy path. There's a lot of sacrifice, like in your training and in your career as a whole. It'll take time from your family, friends, but you're doing it for the good of the patients and because you love what you do. So it's like you have to make a really mature decision when you commit yourself to heart surgery, and you should only do it if it's the only thing that you can see yourself doing. Because if there's anything else, you should probably do that other thing because it's going to be less sacrifice. But if you get the bug like me, then you just got to do it,
Okay. Yeah, that's what I usually hear for medicine in general. If you can't see yourself doing anything else, then you should pursue medicine. So that's what you're basically saying for surgery in general. Yeah.
Exactly. Yeah. Exactly. And you're gonna hear that like from people in other like surgical specialties. Like if you interview someone in neurosurgery, they're gonna tell the exact same thing because it's a field like a very similar sacrifice to heart surgery in terms of the hours.
Yeah, I think surgeons honestly impress me the most because their lifestyles, what they take away, like you're always in the hospital constantly. You don't know how long the hours are going to be. Maybe you're like you mentioned, things could go up till 1-2 a.m. You don't know when you're going to get off the clock, and yeah, it seems like you really embrace the lifestyle and that you're active. Your hobbies are being active as well. So that's honestly kind of crazy to hear. How do you stay active? How do you stay like awake at all times? Like how do you have that energy? Like I've seen this one neurosurgeon on TikTok where he has his morning routine and he has like 3 shots. I think he has like 10 shots of espresso or something insane like that. God. Yeah, it's crazy.
Man, that's crazy.
I see Keurig behind you. Do you drink a lot of coffee? What's your trick?
I mean, I've never really used this one. Like I actually haven't been in this room that much, but coffee is definitely important for me. Mm-hmm. Like I need at least 1 cup of coffee in the morning. That's my thing. I love being able to like sit down in the morning, usually in the hospital, and just drink my coffee like as I look over patients and I look over like whatever cases we're going to be doing for the day. Mm-hmm. How do I stay active in the hospital? Honestly, the pressure just keeps you going. like the pressure of the responsibilities that you have really keeps you going. As a medical student, it's a little bit harder since you're not assigned much responsibility with patients or much responsibility at all, really. So there's different driving factors to keep you active and engaged like throughout the day. But when you're an intern and you're realizing that you're responsible for patients and their care being executed, that keeps you going, because if you slack, it means a patient didn't get a study that they needed done, and now you're delaying their care, and now someone above you is going to be upset at you. Mm-hmm. So there's like a lot of pressure that just keeps you going. But honestly, a lot of it is self-imposed, because like you want to be as best as you can in the job, and you want to do like what's best for patients. So like that pressure isn't coming from above. Like, at least for me, it's coming from within me to take the best care I can for patients. Mm-hmm. So that just keeps you going, man. The coffee is just to avoid the headache.
Okay. Yeah, like they say, pressure isn't given, it's earned.
Exactly.
You need to have that ability, and you need to produce. You need output. I like I said, I watch basketball, so LeBron has that quote like where, pressure is not a privilege. You have to earn it every single day. If people expect something out of you, then that's good. That means that you built up a status where they expect you to drop 30 points, or they expect you to drop a triple-double, or they expect you to be on top of your game at all times. So like you said, your lives are at risk here, so you have to be on top of your game at all points. That pressure keeps you awake. That pressure keeps you on the top of your game. Yeah.
100%. It's a passion and commitment to what you do, what just keeps you going. And of course, if you're like actually like super, super exhausted, mm-hmm. you just take another coffee and keep going, you know. But I'd also like to be able to do that. Like whenever you get a chance to rest, you gotta rest. Yeah. Like whenever you get a chance to eat, like you gotta eat properly. And that's something that my parents and my fiance have been concerned about. They're like, Henry, you gotta make sure that you eat, that you take care of yourself. Mm-hmm. So like, here's a saying in surgery that I'm probably gonna butcher it, but it's like sleep while you can, eat while you can, and don't mess with the pancreas. Pancreas will mess you up, man.
Okay, yeah.
But yeah.
That's how it is, yeah. I mean, what's your go-to coffee order? Let me hear it. Are you
take a guess.
Black coffee.
Yeah, man.
I knew it.
No sugar, no nothing. Just black coffee.
Were you one of those people that... Oh, sorry for interrupting.
No, go ahead.
Are you one of those people that said, I swear I'm never going to drink coffee in my entire life, and then they end up drinking coffee? Because that's a lot of people I've met.
No. Like I've been drinking coffee since high school. I started more like with lattes that we would make at home. Which it's not really like lattes what we made. Like I don't even know like what we made at home in Nicaragua, but it was like coffee and milk. I don't know if it was a proper latte since we didn't have like an espresso machine or anything like that. But eventually I kind of fell into the spiral of just drinking straight black coffee. It gets me more into a work mindset. If I'm drinking coffee for more as a sweet treat or pleasure, I usually have a latte. Latte or a cortado. My fiance got me into that. Cortados are good.
Cortado. I haven't heard of that. Okay.
It's essentially like a double espresso and a little bit of milk.
Okay. Yeah, I don't drink coffee, at least not yet. No? So maybe I'll get to that point, but
it's coming.
It's coming. It's due.
No. Here's people who like actually make it through like without drinking coffee. Like one of my best friends from medical school, like they did not drink coffee, and she went throughout like the whole thing, all of the exams, no coffee needed. Wow. So there's hope.
There's hope. Yeah. I mean, I like drinking tea. Tea's pretty good too, but I don't.
Yeah.
It's not like I drink it to keep me awake like people drink coffee.
I think.
Yeah.
Yeah. But I mean, like, there's some teas, man, that have a lot of caffeine.
That is true. Yeah.
I don't know. I'm gonna see how you're doing, like, when you're an intern. We're gonna see how much coffee or tea you're drinking.
An intern, that's gonna be at least 8 years from now, but
Oh man.
that's gonna, yeah. At that point, wait. Let me ask you a question. How do you see yourself in 10 years? What do you expect to give back, whether it's to the community, or mentorship, or something along those lines? You know.
In 10 years.
What's a big goal of yours? Yeah.
In 10 years, what do I hope? 10 years, let's see, I'm 26 right now. I'll be 36 a couple of years into my career. Ideally, I'll have 2 kids by then and have a nice house with my wife where we can call it a home. In terms of my career, I want to be a full-time heart surgeon. I love the aorta, so I'll maybe like focusing more on aortic surgery and like bigger goals, right? If it were possible, I would love to do like education or mission work in Nicaragua. Since I'm already deciding to practice outside of Nicaragua, I feel an internal obligation to give back to my country. I don't feel that it's 100% fair that I just don't give anything back to my country. So I would see myself going to do like some training of local surgeons, because if you just go and operate at a country where there aren't many resources, like you're just doing like a one-time favor and leaving. But if you focus on education, you can create a more sustainable impact wherever you do a service trip. So that's why in my idealistic mind, I would love to do like mission trips back home where I can focus on like surgeon education, on whatever techniques I'm doing in the United States. Like all of that to be able to help my people in Nicaragua, right? So it's not only going to be about the operations that I do there, but whatever I'm able to bring to the surgeons in Nicaragua so that they can do it themselves too. And of course, I wish to have like good relationships, you know, with like up and coming like heart surgeons, medical students, pre-med students. Like I really enjoy mentoring, and it's been such a great part of like being like when I was a medical student, like mentoring pre-meds, and now as an intern, like mentoring medical students. It's always been like a big part of what I do.
That's great to hear. Yeah. Can I tell you a story real quick? So
Yeah, go ahead, man.
So yeah, I have heard of stories like that people just go back to other countries and that they give back to other people. So yeah, it's good to hear that you want to do that too. And one thing you didn't mention, you mentioned it towards the end, but inspiring other people, like you said, you said your uncle was a pediatrician, correct?
Mm-hmm, yeah.
Yeah, like what if when you go back, a kid sees you and they get inspired? They're like, wow, this person's here, and they went to the U.S. for medical school. They did their practicing physician over there, but they came back and now they're helping out the community here too. So I think that like the thing you said at the end, mentoring people, inspiring other people, helping people out in general, whether it's pre-meds, medical students, or even little kids, inspiring people to just look up to you and see what you do and think that it is possible, especially as an underrepresented community in Latinos, that you can make it to the point that you're at right now. So do you have any, like, could you give one tip for just in general? It could be for pre-meds, it could be for medical students, it could be for Hispanics in general that want to make it in medicine. One tip to get to the point where you're at right now. Very broad.
Okay, this is this is my favorite saying from my dad. I'm gonna say it in Spanish and then I'll translate it to English. And some people might not like it, but I'm blunt and I'll just go for it.
Okay.
In Spanish, it goes like this: No te preocupes, ocúpate. So
I like that.
don't worry, get to work. If there's things that you have to get to, or like things that make you nervous, or that they're like pressuring you, don't worry about them. Act on it. If you don't act, that worry isn't gonna go away. And that has been one of the driving principles behind everything that I've done since I graduated high school. Like there's like so many pressures that you face, but if you stay mindful and you realize that the only way to make the worry go away is by getting to work and taking action, that will get you that will get you anywhere. That will really get you anywhere. There's like a lot of self-agency that needs to take place, a lot of hard work. But if you're just mindful and you realize that there are so many worries that you might have in your head, that you can just get rid of them by taking action. And that's the hard part. Like taking action is not easy. Like nerves, worries, they can paralyze you. But it's like a hard truth that just gotta get to work.
Yeah.
You just gotta grind it out, you know. So that's why I say that it's not like a super popular advice. Mm-hmm. It's not the easiest to hear or swallow, but you just gotta go for it. And I promise you, like if you just do the work that you need to do, you put your mind to it and you work through it, you're gonna get to where you have to be. Like if you work hard and are determined, you will reach your goal. And if there's bumps along the way, you just like adjust and keep going. Yeah. It sounds so cliche, it sounds so broad, but there's a reason why it's cliche, broad, and said so often, and it's because it's true. And that's been proven to me like throughout the efforts that I've done, and it's something that I plan to continue doing. Like I'm like at the base of the mountain in my career, right? It's like everything that I've done has brought me the opportunity to be a heart surgeon, and now I'm like at the very beginning of that now. So I see all the challenges that are ahead of me, and it's like, okay, I mean, a lot of things worry me, a lot of things make me nervous, but there's only one thing that I can do to make them go away, and it's like, just gotta work through it. Put your mind to it, head down, work.
It's like saying "ponte las pilas." They're always like push through it. Like I always hear this one thing. If you're going through hell right now, if you're in hell, why would you stop? Why would you stop where you're at right now? Just keep pushing through it. And sure, it is, like you said, a little bit of a toxic mindset. Some people don't want to hear it, but you just need to push through it. You need to go through it, do adjustments, do whatever you need to do. Maybe take a day off. Maybe connect with your family, your friends, your loved ones. Definitely, you need to have a support. You need to definitely have support, and then just push through it. Get right back at it.
100.
Yeah.
100%. Like I'm not saying that this is something that you do alone. Like you need support from family, friends, loved ones. Like you need to take everyone with you. Like if you have support to go through everything, that's what's best. I'm not recommending doing this alone at all. Like you gotta take care of yourself, and at some points like you can have that mentality of like work, but sometimes an additional hour of work will not yield. Okay, how do I say this? The benefit of an additional hour of work might be less than the benefit of an hour of rest. So you also have to be mindful that resting, eating, having fun with your friends is also productive to you as a human being. Like that will make you better. So you also have to be intentional about hanging out with your friends, talking to your family, and everything like that.
Okay.
Like, you really can't do this alone.
You can't do it alone. Yeah, that's right. I was stuck in the mindset before years ago that I have to do everything on my own. If I can't understand it, then I just need to work even harder. But sometimes there's people that could help you. Surround yourself with people that know more than you, especially, and learn from them. Yeah. This is AP Med. We just interviewed Dr. Del Carmen, and the theme I would give for him is just keep pushing through it. Just do it.